Okay, so basically what happened today was that I went to my surgeon, um, Winston Tan, and he just basically had a really short conversation with me about what the surgery is going to be like, and told me to sign some papers because this is the last appointment before I'm going to go for the surgery on Monday. And I asked him some questions and I just reiterated the fact that I'm really, really conscious about my nose. I mean, I don't really care what he does as long as the underbite is gone and my nose is fine. Then he told me that there is a way for him to rotate the upper jaw, such as when he rotates it, this part comes out, so it solves the paranasal flatness, and then he'll be able to make a cut, if you will, in the bone and put the soft tissue back. The nose is actually consists of a hard bone and the soft tissue below, and he's going to be able to sort of solve the flaring of the nostrils and the movement of the nose, or basically minimize it um, through this cut. So basically, I'll have titanium plates here and here, and well, and the normal underbite surgery parts as well. And well, I don't really know much about it, but I'm gonna trust him. And immediately after the surgeon's appointment, I went to see my orthodontist to get hooks done, like not these golden ones, but these silver ones. Uh, yeah, I don't know if you can see them. Hopefully you can. Basically, it's to um tie them up during the surgery to see if the bite is good, and also to use them after the surgery to make sure that I don't open my mouth and sort of just screw everything up, and just to prevent movement basically. And well, that's about it really. I mean, that's all the pre-surgery preparation that has been happening. Basically, it's just doing your braces for a year. I've been doing it since I think the 10th of June 2012. Yeah, and now it is well, November actually, so it's more than a year. It's actually about a year and 5 months. And when your teeth are just about ready, they'll replace the normal wires with surgical wires, which is what I have on now, hence the golden hooks. And then they'll place on more hooks before the surgery, like what I did today. Um, I've received some questions from my friends actually asking me, why do I need braces before the surgery? Why can't you just do the surgery? And well, for me, I don't know about other cases, but I would assume that's the same. Normally, when you have an underbite, like this is your lower jaw and this is your upper jaw, it's like that. Okay, your teeth are like, imagine the fingers are like the teeth. So when your teeth are not aligned, they'll naturally try to meet with each other, so it becomes like that. And when you bite, it's like that. You still have the underbite, but teeth is actually slanted. So if you do the surgery straight and you move it like that, okay, you'll not have a good bite because a good bite should be like this. So when it's compensating for the gap for the underbite, what braces does is to decompensate it, such that the lower teeth becomes like that, and the upper teeth becomes like that. So basically, it actually worsens the bite because what your teeth were trying to do was to compensate for the gap, and it doesn't look like you have that bad of a problem. And when you do braces, you decompensate, and you have, well, a really obvious underbite like what I have now, and then it's only now where you can do a good sort of movement and you'll get a good bite. Basically, that's why people normally need to take off wisdom teeth. I mean, I had all four matured and all grown out, and I didn't even have to extract them. But because of surgery, I removed all four of them, which to me, well, I actually thought that wisdom tooth means well, somehow a sign of wisdom. I was quite proud of having them, but now I actually don't have them anymore, so that's quite sad. Um, but yeah, that's uh, you have to remove your wisdom tooth and your wisdom teeth, so they have more room for incisions and like for surgical prep, basically surgical movements. And you'll have to do braces unless your teeth is already rather aligned. It didn't really compensate itself that much. Then maybe you don't really need um, braces to begin with. But actually, my teeth, they only did that, but they're actually really, really straight to begin with. And yet, I need braces for quite a long time. So I would assume that most people will still need it. And yeah, that's the only question that I thought I would just raise for people who are in the pre-surgery stage and thinking what is going to be involved. My surgery will be on the 25th, which is 25th of November, this coming Monday. I'll have to go to the hospital for a cross-match blood test on Saturday. Basically, it's to take my blood to ensure that the blood they have in the blood bank in preparation for my surgery matches mine, so that if I do need blood, which the surgeon already said that they rarely need um, an extra, you know, blood donation from someone else. But in the event that they do need the blood will have to match mine. And I went for an autologous, autologous, I don't know, autologous blood donation actually last week, but the nurse said that my veins are too thin. That's why they can't draw blood from me, and I can draw blood for blood tests, but to get a whole bag of blood in preparation for the surgery, that's going to be too much because she said my veins here are too thin, which, you know, is just like that. And I asked her if it's because I'm too fat or anything, and she said no, some people are just born with thin vessels. So I'm just going to assume that it's not a health thing, it's just a thing, and that's that. But anyway, that's what I'm going to do on Saturday. I need to go and get a cross match done. Meanwhile, between now, which is Thursday night, till Monday, I'm going to be eating, clubbing, having fun before I get hospitalized. Monday itself, I'm going to just say what I'm going to do now so that I'm not going to update you guys immediately after the surgery because it's just physically impossible. On Monday itself, the surgery starts at 2 p.m. I'm going to be going in at 12 p.m. for administrative matters and just prepping and stuff like that. I'm meant to be hospitalized for 2 to 3 days. The operation is estimated to last from 4 to 6 hours. And well, my parents believe that I should just stay in the hospital for a longer period of time, especially when I'll be on a clear liquid diet for a bit, because, well, it's really difficult to get access to sufficient and nutritious liquid diet in Singapore, as far as I'm concerned, because I don't really live in a very convenient area, and also I don't really have much help with meals at home because my parents are really busy, and my domestic helper has left us to go back to the Philippines. So yeah, that's in general what's going to happen. I'm going to be hospitalized for about a week or two. So yeah, that's all for pre-surgery, and I'll see you, I think, after surgery, unless I have anything else to add.